From Act that New Zealand first put a proposal up in Parliament which they voted against. It lost by one vote for 3 free GP visits for the elderly. When the party was formed in 1993, one of its founding principles was a rebuilt public health service with sound health care. So what do they say in 2017? Roger, please come up, I've got a spare copy for you. Health is a critical investment in New Zealand human resource, not a balance sheet item. New Zealand First believes a properly funded and resourced public health service will not only prove better for our country, but save money in the long run. We must accept that health outcomes are a defining feature of our first world status. Where once New Zealand was in the first 5 countries in the OECD, we are now in a much inferior position, in the bottom third for infant mortality. We're going backwards.
Yeah.
If a government stands still, then, you know, okay, they're standing still. But when you're actually going backwards, you do have to ask the question, what are the priorities of this government? And we know what the priorities are. Flogging stuff off, you know, to foreign owners, land, companies, electricity, sell it all. Inflate the values of houses by bringing in mass immigration. And then everybody in the cabinet is suddenly 10, 20, 30, 40, $50 million better off. That's what's driving immigration. If you look at the directory of private interests and members of the current cabinet, you'll understand how much land they own and how much money they've made on it. I stood against Ian McKelvey in Rangitikei in 2014. At the time, he was the richest MP in Parliament, so it was a big ask. But he was worth 50 million. He's not even the top 5 now. And that's what's happening. So healthcare, it doesn't get any more important than healthcare. When you're sick, when you're ill, we've heard about the end-of-life provisions. Health is too important to have another priority in front of it.
Yes.
We'll go over this.